Hello and welcome to the Transitions Hair video blog. My name is Andrew Wilson. I'm the owner and director here at Transitions Hair, Sydney, Australia. Today we're talking about alopecia treatment options. Okay, now before we get into that, I just want to bring a couple of things to your attention about treatment options. First of all is that alopecia is highly unpredictable. Okay, sometimes the hair can grow and it can grow back completely, but then it can fall out. And then it can regrow again and fall out, and so on and so forth. It can be this continuous cycle of hair loss. Yet for some other people, your hair that can fall out and it can just stay that way, unfortunately. It may not regrow. The second thing to remember is that there's actually no cure at the moment. Okay, there's no cure yet. There is some exciting things in the pipeline that do look promising, but you need to stay tuned for that. Watch this space. I'll try to bring you the most up-to-date information as it becomes available. So in a generic sense, treatments, there's about 6 different things that you can try out. So 6 treatments for alopecia. First of all, the first course of action should be cortisone steroids, or there's bigger names for that. Basically, cortisone is what they're using. Also, using it in the form of an injection form. Now, steroids or cortisone is a powerful anti-inflammatory drug that helps to suppress the immune system. Now, injections have proven to be the most effective if you get in early. In fact, it will increase your chances by about 50% of hair regrowth if you get in early, okay? Than if you don't do anything. So that's good, please do it. Please note though, the injections are painful. Anything going into your scalp is not nice, and usually you need them every few weeks. If it's going to work, oftentimes, it might be between 6 to 8 weeks before you see any kind of results. So give that a go as your first option. Second thing is cortisone creams. These are less effective because you're applying them onto the scalp rather than injecting them into the skin deeper where the hair follicles are. They certainly can help. You'd have to apply them on a daily basis. The third option which you can try it is minoxidil. Now this is something which is effective in androgenic alopecia, but that's quite a bit different from alopecia areata or autoimmune related hair loss. Now studies show that it is not that effective in alopecia areata treatment. However, there's no harm in giving it a go. It certainly does act as a vasodilator, does help to stimulate the blood vessels around it and also the hair follicle. Give it a crack, you've got nothing to lose. Check with your doctor first. There is also laser therapy. Now, laser therapy is something which is often put forward as a treatment for alopecia, and anecdotally, people do report that it has been beneficial to them. However, there are no clinical studies that will, like for alopecia areata or the autoimmune related form of alopecia. So I can't stand here today and say, hey, give that a go, it's definitely going to work for you, or it works in this percentage of people, because there are no studies to tell me about that. There are probably other things you can look at. The fifth thing that we can talk about today is lifestyle factors. Now, people often say that stress is the cause of alopecia. In reality, it's actually not. Stress is not a huge contributor to alopecia areata, though it certainly can be. And so if you've noticed that at peak periods in your life, peak periods of stress, that you're starting to get patches forming on your scalp or on your body, chances are it is related to that. So remove yourself from those stress factors. Certainly, sometimes you might have a really important job, but I would think that your hair and your overall health is more important than that job. Your body is sending you a signal. However, in all these things, that's easier said than done. Now the sixth thing I want to relate to is what they call photochemotherapy, otherwise known as UV light treatment. This is something where they'll treat your scalp with UV radiation. It's something that's probably fallen out of favor over the last few years, though there are some small studies that will say that it has acceptable cosmetic results. My personal experience of 22 years in looking after people with alopecia is that it doesn't really do a lot. It isn't very successful. If you are going to do it, be careful with it. Only do it in small doses and don't do it over long periods of time, as it could potentially cause melanomas or skin cancers and the consequent other problems that go with that, plus the premature aging of the skin. So what are the new developments in treatments? Well, there are some clinical trials going on at the moment. There have been some good results, predominantly with people that have only had a short-term alopecia, for people that have had long-term alopecia, like over 2 years, they haven't found these new treatments to be all that effective. As I said, this is a really exciting new area, and I probably want to give a separate episode, a separate blog post to this, so stay tuned on that. The other thing that you would probably want to look at as well, like the 7th bonus option, is cosmetic approaches to alopecia. So these are wigs and various forms of hair extensions or crown extensions, hair systems, those sorts of things. We'll look at this in more detail in future episodes, so please stay tuned. I hope you found this helpful. I know I've whisked through it in a very fast way. If you've got any questions, please send us an email, fill out a form on our website, and that will get to me and I can respond to that in future episodes. Otherwise, have a great day. I hope that was helpful. Thank you for watching.